aortic arch. From the aortic arch, that first vessel that comes off is the brachiocephalic trunk, right? And for the brachiocephalic trunk, that leads to the right common carotid and the right subclavian. The second one that comes off of the aortic arch is the left common carotid. Remember, that's its own artery. So if you have somebody who passes out, needs CPR, they always feel on the left side to feel for that common carotid artery because it's coming directly from the heart. So if there's no pulse, CPR, they start compressions. If there is a pulse, at least they know the heart is working because this is coming directly from the aorta, okay? The left subclavian is this, left subclavian artery is this artery here. Okay, coming back down, remember we have the internal jugular. So this is the right internal jugular, left internal jugular, joining with the right subclavian vein, the left subclavian vein, and both of these will become the right brachiocephalic vein, left brachiocephalic vein into the superior vena cava, which will then enter into the heart. Okay, the trachea. So we know about the trachea, which is our like windpipe that kind of like opens up to allow air to go in and out of our lungs, help with oxygenation and gas exchange. So if we look at this model here, you'll see that it has the hyoid bone. So remember the hyoid bone that we learned in the first practical. This is the thyroid cartilage. This is the cricoid cartilage. And below that, we'll start the C-shaped. So you see how it's just from here and goes all the way around. This is the C-shaped tracheal hyaline cartilage. So I don't know how your teacher wants you to know or say tracheal cartilage, C-shaped cartilage, hyaline cartilage. Just make sure you put it in there somewhere. Tracheal hyaline cartilage or C-shaped cartilage. So if you look at the model from this view, I don't know if you can see from here, see how it's a C-shaped? It gives room for the esophagus. So when you swallow food and food is moving down behind the trachea, there's a muscular region back here. So it's only C-shaped with the cartilage to keep that structure open, to keep the windpipe open so it doesn't collapse when I breathe out. It stays open to allow air to go in and out, but this muscular region in the back allows when this esophagus fills with food and it's like the bulging through peristalsis comes down behind the trachea, the muscle helps the esophagus expand and allow food to pass through easily, and you don't feel every rump as it goes down. Okay, if they point here and point to and ask you the region, this is the apex of the lungs and the base is on the bottom of the lungs. Not diaphragm, just this region there is the base. Under here would be the diaphragm. So let's talk about the trachea. As it goes down, the trachea from this region, you have the trachea, comes all the way down with the C-shaped cartilage, comes down to this region here that looks like a triangle. This is the carina. Then it branches off to the primary bronchi. So this is the right primary bronchi, left primary bronchi. And then you have the secondary bronchi. Each secondary bronchi will enter each lobe. So the left side has only 2, the right side has 3. So this is secondary bronchi. Once it enters the lobe, it will then branch off again to create the tertiary bronchi. So from tertiary bronchi, it goes to bronchioles or multiple bronchioles. And then all you have to remember is tradas, T-R-A-D-A-S. T is for terminal bronchioles, R for respiratory bronchioles, A-D, alveolar ducts, and then alveolar sacs. So just in case you have to name the pathway of air or list the pathway of air, you start from the external nares and go all the way down to the alveolar sacs, okay? And I think that's a lot. Thank you.